tennis elbow isn't just for tennis players, and stretching it and resting it isn't the most optimal cure. In this video, I'm going to teach you 2 effective exercises that you can use to reduce tennis elbow or any pain localized along the outside of your elbow. And to do these exercises, you don't need any fancy equipment. A set of dumbbells and resistance bands can be used. Likewise, you can grab anything out of your kitchen cupboard if you don't have access to that. But first, I need to tell you the 2 important movements that you're going to focus on. The first one is wrist extension, which is performed by lifting the wrist up towards the ceiling, keeping the forearm nice and still. And the second movement is wrist supination, which is done by just turning the palm upwards towards the ceiling. Imagine you're holding a bowl of soup. Now, the reason that you're focusing on these 2 movements is because we're trying to target the tendons that sit on the outside of the elbow. And in tennis elbow or lateral epicondylitis, these tendons become very irritated. And this problem isn't due to these tendons being tight, it's because they're overloaded. And if you don't start strengthening them, they're not going to get any better. So the first exercise we're going to do is wrist extension. I'm going to show you how to do it with the band and how to do it with the weight. Now, for the sake of the resistance band, anchor it underneath your foot. Using your effective side, put your forearm down on the table or your lap. Hold it nice and tight in your palm. And from there, you're just going to lift your wrist up towards the ceiling. Top tip with this exercise is just try and keep your forearm nice and still, so you're predominantly using your wrist, and that's it. As you do that, you should feel pressure on the outside of your elbow because we're localizing the pressure to those tendons. You're going to aim to do 12 repetitions, and then you're going to have a rest for 60 seconds, and then you're going to repeat it another 2 to 3 times. And at the end of the video, I'm going to give you my top tips as to what you should be looking out for when you're performing these exercises to get maximum results. And the same tip if you're using a dumbbell, just let the wrist drop and then lift the wrist up. Just make sure when you're doing these exercises, you try and do it slowly. Muscles and tendons love a bit of eccentric action, which basically means time under tension. So as you lift the wrist up, you can do that as a normal pace. But as you lower the wrist down, almost double the time it takes. So if I go up in 1 second, it takes me 2 seconds to go down. Now, the second exercise is based on that second movement, which is wrist supination. And to do that, it's a little bit different. You don't need the table for this position. And if you're using a resistance band, grab it and then anchor it in the other hand. From there, with your palms facing down, you're going to hold your unaffected side nice and still. That's your anchor. And then for the other side, you're just going to rotate your palm up towards the ceiling and then back down again. Now, as you do that, again, you should feel pressure on the outside of your elbow as we're moving those tendons. Just try not to move the arm when you're doing this. You're simply just rotating that palm up. If it feels easy, just add a little bit more tension on that band. And for this, you're aiming for 12 repetitions again. Have a rest for 60 seconds and perform that 2 to 3 times over. And just make sure when you're doing this, as you turn that palm down, you do it in double the time it takes to turn the palm up. But my top tips of these exercises, don't push into pain. Ideally with any form of tendonitis or tendinopathy, we don't want a pain more than a 4 out of 10 on a pain scale, whereby 10 out of 10 is the worst pain imaginable and 0 out of 10 is no pain. If you can tolerate a 4, you're okay. If it's more than that, you just need to stop. But before you stop, just think about reducing the resistance. Grab yourself a lighter weight, use a lighter resistance band, or drop the resistance altogether and just perform the exercise actively. Tip number 2, you don't need to do these exercises every day. If you think about it on a scale, this is how much you're putting through these tendons and this is how much you can tolerate. If you start doing this every hour of every day, you're creating a bigger deficit. So we want to strengthen it up nice and slowly. So every other day or just once a day is absolutely fine. Any more than that, you're not doing yourself any favors. And tip number 3, avoid too much compression around this structure. Now, massaging it is absolutely fine using these 2 fingers. Grab a bit of lotion and just gently massage the muscles and the tendons around this area. But if you have a really tender spot and you start digging into it, again, you're not doing yourself any favors. If you have any comments, just leave them below. If you enjoyed this video and you want to follow along for more, just click that subscribe button. And next time I'll do a video on golfer's elbow, which is pain localized on the inside.